undeniable, but growing concerns about safety and standardization have led to calls for the regulation and professionalization of their services. Recognizing this, the governor of Akwa Ibom State, Umoino, has pledged to train, certify, and integrate TBAs into the state's primary health care system. This initiative is expected to bridge the gap between traditional and modern maternal care practices. Governor Eno also announced plans to enroll pregnant women in the state's health care insurance scheme, a move experts believe could significantly reduce maternal mortality rates in Akwa Ibom, where, according to the Nigeria Demographic and Health Survey (NDHS), maternal mortality remains a major concern.
As society evolves and old approaches get subjected to modern and advanced methods to ensure wholesome and holistic outcomes, I wish to employ and advise that you also, if I may add, reinvent your methods of carrying out your duties. We are willing to partner with you to train, to certify, and to supervise your members, so the services you provide are aligned with contemporary methods, thus making it more acceptable to the larger society.
I've been embarking on training on the TBAs. Such of those training is personal hygiene, disease and prevention control, how to stop maternal mortality rate and morbidity rate. It is possible for a mother to be infected and she put to bed without the child being infected. So the rules of the TBAs is very important. We are not saying that everyone should use the TBAs, but there are some concern. There are some people that, for example, when you talk about factors such as poverty, there are people that cannot afford 3 square meals in a day. If they can afford this 3 square meals in a day, how are they going to afford medical bills? These are the people that they run into when they have health.
Experts assert that beyond delivery assistance, TBAs can play a critical role in family planning awareness and early detection of pregnancy complications, helping to improve overall maternal health outcomes.
So there are protocols in place. So I think that they need to be integrated into those protocols. However, it could be stepped down to their level for them to understand and follow it. That will be necessary. Training and retraining of these traditional birth attendants is a must. And then their community needs to be regulated. It needs to be regulated. There has to be acceptable standard of practice for one to operate in that domain. So government needs to come out to regulate that sector. Who qualifies to work there? What are the basic requirements for working there? So if all of that is standardized, I think it will help improve their practice instead of just wishing them away, because I think it will not help.
But why do women still prefer TBAs over hospitals? Several factors come into play, including deep-rooted cultural beliefs, economic constraints, and fear of surgical procedures like cesarean sections. Some mothers who spoke with TVC News expressed their preference for TBAs, citing trust, affordability, and personal care as key reasons.
Because they know they all a golden knowledge, so that is why they have knowledge about the delivery. So that's why I don't like hospital. Okay. I like them more than hospital.
My first one was CS, so that's why I was thinking that it would be the same CS, so I now went there. So, but I delivered safely without CS.
Some of them, they will come without nothing. When they came to deliver, they will come without nothing. I will be the one that provide everything for them. Even though some of them, when they deliver, there is no money for them to pay me. Even I will give them food, join. Sometimes I will give them transport to go home. That's why I plead with my governor to help TBA.
In terms of delivery, we help them with the advice we receive from the hospital, because there are some cases we ought not to handle, and there are some we handle. And even those that we can handle, if on the way we have a problem, we are entitled to take them to hospital.
So while it is established that traditional birth attendants play a role in communities across Nigeria, experts say bridging the gap between cultural practices and modern medical care remains key. Miriam Daniels, TVC News, Uyo, Akwa Ibom State.